Welcome back. We are wrapping up the month of May, but we don't want to let it end without talking about Osteoporosis Awareness Month. Osteoporosis is something more than 10 million Americans face.
Insurance data tells us there are more than 20,000 diagnoses in Connecticut, but the risk starts earlier and affects many more Americans than that. The Bone Health Foundation estimates 44 million Americans have low bone density and are at great risk.
So Dr. Katherine McLeod from Quinnipiac is joining us now to talk about what can be done. And Dr. McLeod, we certainly appreciate your time. And let me ask you first off, what's something you think maybe people misunderstand about this disease?
I think the disease is often called a silent disease because you can't feel your bones becoming weaker. And so you may not be aware that you even have osteoporosis until after you break a bone from a fall. So after you break a bone from a fall, and if you're over 50, that's sort of confirmation that you have osteoporosis.
Oh, wow. Okay. So, and the numbers are telling us that people are dealing with this at younger and younger ages. You say even 50. That's pretty startling, right? So is it actually preventable for somebody, in your 40s, 30s, 50s?
Absolutely. So from a prevention standpoint, you can do a lot of things, fortunately. Bone health is really a lifelong concern, and the osteoporosis prevention should really begin in early childhood and continue throughout life. So it's adopting those healthy habits early in life that can set a good foundation for strong and healthy bones and ultimately reduce the risk of breaking bones as you age. So we actually build the strongest bone that we'll ever have by our mid to late 20s, and that's also known as peak bone mass. So from a prevention standpoint, it's really important to make sure that children and adolescents are getting enough things like calcium and vitamin D in their diet and regular weight-bearing physical activity. So things like just being on their feet, jumping, running, walking, these are all important prevention habits.
Yeah, but for most of us watching right now, that was decades ago that we would have done something right to prevent this. So what can we do now? What are the things that you highly recommend to prevent this?
Yeah, so the Bone Health and Osteoporosis Foundation sort of recommends these 5 steps to improving bone health and preventing osteoporosis. And this goes for older adults as well, even as you age. So getting the calcium and vitamin D that you need every day, doing regular weight-bearing and muscle strengthening exercises. And that's really not just something as formal as going to the gym and lifting weights and things, but the things that the lifestyle activities that we engage in every day, like gardening and shoveling snow, are all considered weight-bearing physical activities. Things like not smoking or drinking too much alcohol, taking osteoporosis medication when it's right for you. And then really important is talking to your healthcare provider about your chance of getting osteoporosis and asking when you should have a bone density test.
That was my next question. Talk to us a little bit about treatment options and testing, which is so important.
Sure. So in terms of testing, this is an important component. So from a prevention standpoint and management, screening is really important. And one way that we do that is by getting a bone density test, and it's called a DEXA scan. And this sort of gives you a score on your bone health. It's called a T-score. So for women age 65 or older, for men age 70 or older, or if you have had a broken bone, like a fracture since the age of 50, if you can answer yes to any of those questions, then you should really consider talking to your healthcare provider about getting a bone density test. And then from there, determine whether additional treatment is necessary based on those outcomes.
All right. Thank you, Dr. Katherine McLeod. We appreciate your time.
Thank you.